So my name is Harry Buchman. I'm Chief Operating Officer here at Center for Urologic Care of Burks County, Pennsylvania. Been here for a little over a year, and previous to this, I spent the last 18 years of my healthcare leadership career in hospital administration. All the systems and processes that you get used to in big health systems, they just tend to not exist in smaller private practices. So, having this ability with dashboard and some of the things that we've been able to do with MedEvolve to give us the insights and not just the data. I often say, we're drowning in data, but we're really struggling for those insights and those helpful nuggets to be able to kind of chart our course as an organization. Through this process, actually, we've been able to grow. We've hired new physicians. We've hired new nurse practitioners. We're busier than we've ever been. Even in spite of the pandemic, being able to do telehealth and some of the relaxed CMS rules where we can now do telemedicine we couldn't before. So it allows us to reach patients in a variety of different methods. But with this workflow tool, it makes sure that we're still getting the revenue the way that we're supposed to get it, which is enabling us to make all kinds of efficiency changes. And I think patients now also appreciate that we're getting the right amount billed up front. We're getting it reimbursed quickly. We're getting all those things out so they just don't have endless statements month after month, waiting for somebody to say, oh, that wasn't quite right, or oh, we missed the modifier, or oh, we need to resubmit this. So we've heard nothing but good things from patients, and you tend not to hear good things from patients when it comes to billing, but we've had a lot of patients who've been with us for about 30 years or so, and just hearing those good things makes you feel that you've done the right thing. And not only hearing from your internal people that their work day is easy, they feel they know where they stand at all times versus looking through their task lists the way that we used to do it, or their sticky notes or their folder that they had on their desk, but having an automated tool that serves up to them exactly what they need to touch versus scrolling through all the claims that are still in process, appropriately so, has really even helped from a work satisfaction standpoint from the employees. It's interesting going to the board meeting, I have one later tonight, that the doctors, the partners look forward to the insights that we talked about, asking for those questions. Where were we at this month, where they are, and not just what's our percentage of collections, whatever, but they like that we have that structure around it. And it's not just, I had a piece of paper and I can do some math on it, and here's what the business is doing. But that level of insight gives them the confidence that they're making the right investments, the right decisions. Those types of discussions really started with us getting this handle on AR, and we wouldn't have been able to get there, if it hadn't been for the workflow tool and the partnership with MedEvolve. I think what a lot of physicians get comfortable doing is they've been practicing for a lot of years, and they're just really, really comfortable. They don't realize that, if you're not willing to pivot and change because of data and because of trends, you're going to be extinct, or you're going to wind up like a lot of doctors begrudgingly becoming employed because, you can't know it all, and they just want to be physicians. And a lot of them try to take a business class or get an MBA, and they're trying to care for patients and trying to run the business, and all of a sudden it doesn't work really well. It leaves a lot of frustration. And so for me, this was the springboard for which we were able to really help the organization that had been successful for over 30 years pivot, which was scary because they'd always been successful and they've always done really, really well. And to say we have to change almost everything in the business and here's why was scary for them. But the confidence came when we have the reports, we have the analytics, we're making data-driven decisions, and we have a path forward. So I couldn't imagine doing it without this type of platform. And to create it in-house, I would have had to hire 5 or 6 people and pull together a bunch of different solutions to try to get us anywhere close to what we have today.